Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzo.
On today's episode, Paul, we're going to talk about why does my total hip replacement still hurt?
That's a rare question.
Thankfully.
I always have to tell my patients, after you've had your total hip replacement or your total knee replacement, people who've had their total hip replacements generally all love it. Total knee replacements, not so much. But there are some people who do still have pain after their hip replacement.
Yeah, I'd say my knee replacements say thank you, but, and then my hips usually just say thank you, and then that's the end of the conversation. But there are a few situations where your hip still could be sore.
Okay.
What's top of your list?
Well, I think one of the most common things that I see in my clinic in follow-up is some pain from the bursa. So around your greater trochanter on the outside of your hip. I got a hip right here.
Perfect.
So on the outside of the hip here, there is a fluid-filled sac called the bursa. And that can often or sometimes get inflamed after hip replacement. So when you push on the outside of your hip, it hurts. You feel it on the outside of the hip, or if you lie on it in bed, it hurts. So that could be some greater trochanteric bursitis. Yeah,
so like a painful incision, because that's often in a lateral approach, that's where the incision is. So I'd agree that's probably number one. Number two for me would be like muscular pain that people complain of. I got some thigh pain, especially in the early recovery phase. And that relates just to the fact that A, you had an operation, B, you had a large metal implant put inside your previously hollow thigh bone, and C, some of the muscles are disrupted with the procedure.
Yeah, you got to remember, before you had your hip replaced, you could barely move your hip. It was very stiff. It wouldn't internally rotate or externally rotate. Now, all of a sudden, your hip's moving all over the place, and the muscles are like, wait a minute, we haven't moved this way since 1982 when Cyndi Lauper was around. Or was that a bit later? Maybe.
I'm not sure.
Anyways, it hasn't moved like that in a long time. So now that your hip can move through that range of motion, the muscles might not like it right away.
Yep. Three for me would be, I think sometimes the capsule or the lining of your joint, whether it's a hip or a knee, can be a little bit irritated by the presence of an implant. So almost like capsular pain, where some people will say, oh, I still have a little bit of groin pain. It's different than what I had before the surgery, which is gone, but I'm still a little bit achy there. And sometimes I think that's just the soft tissues getting used to the fact that you have an artificial hip.
Okay. And there are some bad things. Those are very, very, very rare, but an infection. If you have a deep infection, that would certainly hurt.
Or heaven forbid a fracture if you had some type of trauma.
Yes, or in where the way we do hip replacements in North America, most commonly is we do not use cement, and we rely on the bone to grow in. In Europe and in England, I think they're still using more cement with the hip replacements. So in our case, when we're not using cement, we're waiting for the bone to grow in. Very rarely the bone doesn't grow in, and the stem or the cup remains loose.
Right.
So some early loosening maybe could cause some pain.
Yeah, and then I'd say the last one is even though it's presenting as hip pain, it's pain from another joint. So either your low back or possibly your knee with some referred pain.
Or your wife or your husband's bugging you.
Yes.
So yeah, that covers it.
So I think beware. Obviously, if it's getting worse, it probably needs to be investigated. Typically, it's going to improve slowly over time. Don't panic, and just continue to work on your exercises. Try to stay as fit and as active as you can.
And hip replacements do work very, very well in the right patient.
Absolutely. So if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
See you next time.